mother reached out to me after watching one of my previous videos about HIE and cerebral palsy or CP. She asked if her baby's diagnosis of spastic quadriplegia cerebral palsy and the need for a G-tube could be connected to what may have happened to her during labor and delivery. This is a tough question and one that I have heard many times from families, and it's an important one. When parents hear these diagnoses, they are often left worrying about the why and the how. So let's talk about what is spastic quad and how it can be connected in some instances to HIE and what we look at in legal investigations when families have these types of concerns and they reach out to us. So let's first talk about what is spastic quad in the context of HIE. HIE, or hypoxic-ischemic encephalopathy, is a type of brain injury that's caused by the lack of blood and oxygen flow during labor and delivery in our context. In some cases, this injury can lead to CP and spastic quad, which is the most severe form. Watch my previous video in which I talk more about HIE and CP in general to get more detail as to this. But for spastic quad, it affects all four limbs as well as the neck and the torso. It can make even small movements difficult because of stiff, tight muscles and a limitation of control. And it's not just about movement. Babies with spastic quad often face challenges with speech, with learning, and even basic needs like swallowing. For some of these babies, these type of swallowing difficulties mean that they can't take in enough nutrition safely and with a traditional feeding. So that's why they need a G-tube. That becomes necessary. The G-tube is placed directly into the stomach to ensure that the baby can get the necessary food and hydration that they need to grow and to thrive. As a parent, this diagnosis can raise so many questions, not just about the medical care, but about your future. You may find yourself thinking about therapies, mobility aids, and even specialized education for your child. These types of needs can come with a lifelong, recurring, and significant time and energy and financial resources. So this is why so many parents, they may ask whether their baby's HIE and CP diagnosis, whether they could have been prevented. As a birth injury lawyer, it's my job to help families get answers. And when I review cases like these, I like to focus on what happened during labor and delivery to determine whether medical malpractice actually played a role. So for example, we may examine how fetal monitoring, how was that handled? Were there warning signs like, dangerous changes in the baby's heart rate? Were those type of signs missed or ignored? We also will look to see how quickly did the medical team respond if the baby was in distress? Were there delays performing a C-section? All of these types of things, did they work to limit the baby's blood and oxygen? These are areas that we would investigate. Also things like whether Pitocin was used during labor and delivery. That's something that we have to look at. Whether the Pitocin was being administered the right way. What about if there were forceps or there were other types of tools that were used during delivery? Were they used properly? These are just a few areas that a birth injury lawyer like myself that we will explore to try to get a good understanding as to what may have been going on during labor and delivery. If your baby has been diagnosed with spastic quadriplegia, a CP, and you have an HIE diagnosis, you may have these types of questions. And it's natural to want answers, especially when you're thinking about the challenges that you're going to face ahead. A thorough investigation can help uncover whether medical decisions during labor and delivery, whether that is actually what contributed to your baby's condition. Again, I'm Marcus Boston, and if you have any other questions about your baby's HIE brain injury at birth or a subsequent CP diagnosis, if you have these types of questions from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me in my profile, or you can just wait and watch the picture that follows this video. All right, that's going to be it for today's quick educational video. Have a great day, everybody.